on the health and situation of President Donald Trump since he got diagnosed with COVID-19. Sherwin, what do we know? When we spoke earlier, his symptoms seem to have escalated a little bit. What do we know now?
So he was mild this morning in terms of symptoms, Peter, and then the doctor came out and said, there was a low-grade fever, congestion, and cough, and explained what was being administered in terms of medication to the president. The minute we stopped talking, I saw Marine One, the official military helicopter that transports the president, landing on the south lawn of the White House with news that the president of the United States will now be transported to Walter Reed, a military medical hospital in D.C. It's a short flight from the White House, but clearly an indication here that the president's condition is not improving. It is worsening. The official statement calls it a precautionary measure, and that the president will continue to work from the hospital's presidential suite. Now, that doesn't really tell us much about his condition, but the very fact that he's being taken away from all the facilities, the medical facilities that they have in position at the White House, those now proving not to be sufficient for his condition, and out of an abundance of caution, they're now taking the president of the United States to hospital, where he is said, where he will be in the presidential suite, and where they say he will continue to work. But clearly, the indications are here that his condition has worsened. The big question now is, will he be handing over power at some point to Mike Pence? Does he continue to work if his condition continues to improve? So Mike Pence is on high alert, the vice president. I can also tell you other tests that have happened today for the senior officials in the U.S. government. They include Joe Biden, the Democratic rival, who has tested negative. Mike Pence, the vice president, has tested negative. And Nancy Pelosi, who is second in line to the presidency, were the worst to happen in the United States. She has also tested negative, and they will now continue to work within a bubble, because if Mike Pence were to test positive for coronavirus, and Nancy Pelosi, that would really throw the U.S. succession plan into some turmoil here. But that's perhaps ahead of where we are, Peter. The president now being transported from the White House. We are waiting to see him, if he's going to walk out of the White House to the helicopter. Will he give a thumbs up to the gathered media on the South Lawn? We are now waiting for that moment.
And it's in circumstances such as this that transparency is critical, isn't it? Because then people start speculating, and they've been notorious in downplaying any situation at the White House. And so, yes, they will say an abundance of caution, but we know that perhaps this could be something quite serious now.
Yeah, I mean, you'll remember they used the same kind of language when Boris Johnson went into hospital. They talked about how he was in high spirits and doing fine while he was being taken into ICU. So, I mean, language here is going to be very important, especially when you talk about the commander-in-chief and the implications that would have on governance in the United States. I will tell you what Nancy Pelosi said earlier today, Peter, in one of her interviews. She said maybe this is a pivotal moment to take us to another place where science and not politics leads the way. She said that this was a prayerful moment for the country. And certainly, I mean, if you like Trump or don't like Trump, this is a sad moment for the United States to see your president being transported to a hospital, having contracted a disease that has killed over 206,000 Americans and infected over 7 million Americans in this country. He is in that high risk category. He's a 74-year-old man. He is medically obese, which in itself is an underlying condition. We also understand that the president has suffered from cholesterol over the years. We don't know what other underlying conditions he might have and how those are factoring into this decision now to transport him to the White House. There are so many unknowns in terms of the president's medical history. And so you correctly point out that transparency now is going to be the key word moving forward in terms of the science, in terms of COVID-19, in terms of the efficacy of masks, social distancing and washing of hands. Enough about the hydroxychloroquine and all that nonsense that has really just been a distraction here. Nancy Pelosi's words, maybe this is a pivotal moment to take us to another place where science and not politics leads. And I don't think any reasonable person can argue with the Speaker of the House of Representatives.
All right. So, typically, what happens in these kinds of circumstances? I mean, we don't have many precedences, but the military base, medical facility that he's going to, I suppose, is the equivalent here in South Africa, where we remember Madiba was under the care of the military medical facilities.
Yeah, Walter Reed is a familiar stop for the president. Every quarter or every 6 months, he has to go for a medical checkup. They do this in the military facility. He has his own presidential suite. It's probably pretty well kitted out for when they do spend time there doing the physicals, which sometimes take a whole day because they check everything. So this is not uncommon for the president of the United States, but this is now an emergency situation. This is not a planned, let's, drop me off at Walter Reed for my checkup. This is, I am not doing well. I have a fever. The trajectory here doesn't look good as matters stand now. The only reason you're going to hospital is not because you're getting better, it's because you're getting worse. And as a preventative measure, as a mitigating measure, they want to have the president with access to the very best facilities. Maybe they don't have enough ventilators in the White House. I'm speculating now, Peter, as to why he would be moved, but clearly his condition is not getting better. We talked earlier, we heard from Mark Meadows, the chief of staff, who talked about the president. He spoke to the president. He was in good spirits. He had mild symptoms, and progressively as the day has progressed. And the reason how you tell if Donald Trump is not doing well, it's if he doesn't tweet, and he hasn't tweeted for 16 hours. Wow. The last tweet he tweeted was, to tell the American public at 1 a.m. this morning that he and the First Lady had tested positive. So that in itself will tell you that this is not, a president that is feeling great if he's unable to tweet, right? And I think that's really a telling factor here, Peter.
All right, we're taking a look at this helicopter. Is that the one they call Marine One?
That's Marine One. That's Marine One. That's the helicopter that took him to that on his travels yesterday to that fundraiser where all these aides, there's a shot of Hope Hicks and Jared Kushner and a number of aides getting onto that military helicopter without any masks on. And there's a picture from inside the helicopter just to show us how confined the space is. And if you are not wearing a mask, then you have very likely infected someone else on that helicopter. And I had a COVID-19 test earlier this week, and what they tell you is if you feel that you've been exposed most recently and you've very recently then thereafter received a test, it's probably the virus is probably not going to show up in your nasal cavities immediately. So they said to me, come back in a week and just double check. And I think that's probably some of the negative tests that you're getting now from the Kushners and the Ivanka Trumps and some of the aides that were in close proximity to the president. They now need to keep checking that the virus isn't showing up in the subsequent days, because maybe it hasn't shown up today like it did with Hope Hicks 2 days ago, and then showed up in the evening on Wednesday, and then when she had another test, it was a completely different scenario. So this is the problematic issues with testing. Testing only tells you what's going on right now. Masks are what blocks the virus from entering your body all the time. Tests tell you what's going on now. That can change 15 minutes later.
All right. I mean, a lot of people are mentioning Hope Hicks's name, but the truth is we don't know that she was the one that gave it to her. For all we know, it could have been the other way around, or he could have got it from a number of other people.
She was the first one to show symptoms, right? But who knows how the virus progresses in a different body. So we don't know when the presidential couple or Hope Hicks were infected. We do know that they tend to travel on the same aircraft, Air Force One, Military One. They go to the same events. Hope Hicks is a very, very close advisor of the president. She was his former communications director. She left the White House for a period under a cloud, came back as a special advisor, and has been kind of in the background coordinating things. And he really, really relies on Hope Hicks and trusts her. So this will have really been a blow to the psychology that this White House tries to put out. A very strong, we're going to beat this, we're around the corner, it's going to go away. This really has shaken the foundations of the narrative that Donald Trump has been putting out about this virus, and it's really hit home right in the residential suite of the White House. And so it's going to be very interesting based on how he recovers or the days ahead, how the White House recalibrates their messaging now. You're even hearing from conservative media like Fox News that support this president through thick and thin. Anchors there are losing their minds, telling people enough already with this nonsense. Wear a damn mask, they say. And I mean, this is a message that we've been harking on and repeating, certainly on this network and many other networks in the United States.
All right. Again, I keep looking at this helicopter, wondering when Donald Trump will make his way to the helicopter. But I guess the images of how he gets to the helicopter are going to be quite key. Ideally, he'd want to walk to the helicopter and give the appearance that things are fine. But if he goes to the helicopter in anything but his feet, then speculation will rise even more.
I mean, I don't think they're going to wheel him out. If that was the case, I think they would have given the president certainly more privacy. What they've done here is they've landed this helicopter on the South Lawn. It's a massive helicopter and it makes a lot of noise and it attracts a lot of attention. So I think there is going to be a made-for-television moment, given who we are talking about here, the reality star president. And one would expect he wants to give people an impression that things are going to be okay. He wants to calm fears and anxiety. Look, there'll be a lot of anxiety around here, around these parts. This is a president that has support in these United States. Some 41% consistently love this president, are ready to die for this president. So I would spare a thought for some people that are really in consternation right now. This is a hero to many people, and they certainly would want him to recover. And I think he will want to, this is a machismo president. He will want to come out, walk out there. He might be feeling terrible, but he'll put on a brave face and probably give the cameras a thumbs up. But as I've said to you constantly in these discussions, Peter, I am, of course, speculating. That's just who we've come to know, as who Donald Trump is over the years.
All right. Not much being said about Melania, but is she going to stay at the White House or is she going to be moved to the military facility as well?
I don't have that answer for you, but I do know that she is suffering from a mild cough and a mild headache and is generally doing well. She's generally asymptomatic except for those mild symptoms. I'm not sure if she's going to travel with the president. It would be unlikely that she would go and stay at the hospital with him, but I don't know. We'll have to wait and see who walks out of the White House when they walk to Marine One in a short time.
All right. Sherwin, we'll leave it there for the time being. Thanks very, very much indeed for joining us.
Thanks, Peter.
All right, so that's your latest update there. Sherwin Bryce-Pease giving us an update. President Donald Trump is going to be moved to a hospital, a military facility, and the helicopter there that we've just been seeing in front of the White House there, going to be transporting him shortly. We don't know what time, when, and we don't quite know what condition he's in. The doctors are saying this is precautionary and that they just want to make sure that all the facilities are there, they're available to the president, and that this is standard. So again, without getting further statements from the White House, they're trying to perhaps reassure, but they're certainly downplaying the situation. But what we know for sure is that the president's symptoms have escalated a little bit. How serious they are, we're not sure, and we'll keep a tab on that. We'll certainly give you a more comprehensive update for you when our sister program, Morning Live, will kick off.